Mike, in preparation for this week's episode on the spectrum of care, I was up at a neighboring state's veterinary convention, and I had the opportunity to sit next to a recently retired, much older veterinarian. I would say probably the start of the boomers. I'm guessing probably 85 years old and very recently left practice. And he took the time to tell me all the things that he felt were wrong with veterinary medicine. And for a lot of them, we agreed. For some of them, we very strongly disagreed, right? Some of the changes in gender and the diversification of veterinary medicine, he blamed a lot of the problems on that. He even said, as an industry veterinarian now, that I was part of the problem because I had a responsibility as a veterinarian to take care of dogs and cats. And that if I was doing anything other than that, even if it was supporting veterinarians, that I had abandoned the profession, was not honoring my true calling. So we had a lot of differences of opinion, shall we say, as we chatted. But one of the things that I found really interesting is he was telling me one of the problems is all these specialists who are constantly offering only the best and the brightest and nothing else. And he gave me an example of a very common thing that we see in ER practices, and I'm sure you see in your practices, even in bougie LA, which is cat abscesses, right?
Yep.
Cats go outside, they get in fights, they get poked by things, and they develop these abscesses that need to be dealt with, or they can be, if not life-threatening, very serious, affects their quality of life. So he was telling me about the problem with veterinary medicine, and he said, let me tell you the problem. He's like, just the other day, now he's been out of practice for a while, so it was probably several years ago, but he said, just the other day, a 6-year-old cat came in with an abscess. Well, I'll tell you the problem. He said, one of the clients demanded that I do blood work and a urinalysis on his cat. And I told him I would not do that because this was a healthy 6-year-old cat that had an abscess. He told me all that cat needed. And then he went on to say he didn't need fluid support of any kind. He didn't need to be intubated when he was anesthetized, just a simple IM injection to get him down so you can drain that abscess, flush it out, give him a shot of Pen G, and send him on its way, and he's going to be fine. He's like, but everybody is like, oh, you got to give him pain meds and you got to anesthetize. And if you anesthetize, you have to, monitor them. And he's like, and the bill is going up and up and up and up. And then how many cat abscesses walk out the door because they see the bill and couldn't afford it and no one offered them anything else? So it was interesting to me because, and we've talked about how
Yeah.
frustrated I get sometimes with the ivory tower folks not being able to accept anything less than the most invasive, most expensive, highest technology. And I'm like, and here we have a guy at the other end of the spectrum of care, only offering the absolute minimum. And there's a whole world of veterinary medicine, of really good quality veterinary care that falls between those two spectrum, if you will.
Welcome to the Vets Unleashed,
where we gather animal professionals and animal enthusiasts to discuss the most pressing, silly, and interesting topics in the animal kingdom. I'm Dr. Scott.
And I'm Dr. Mike. And wow, that was a great story. And as you're saying it, I'm like, oh yeah, I flip-flop back and forth between being that guy and going, to the people that I work with and saying, like, we can get by with doing, if they can't afford everything, this cat will probably be okay if we do a lesser thing. We're going to give it pain meds of some kind. We're going to, you know what I mean? Like, but we don't have to do, he's right. Do we have to do blood work on that one? Yeah, maybe not. You know what I mean? Like, if they can't, if it's the difference between treating the cat and not treating the cat, I agree with him 100%. but I also don't agree with not giving them
Maybe
the
not, maybe not the
option.
pen G or lack of pain meds.
Right. Yeah. Like maybe not there. But I was on board for a little while.
I think some of it is not wrong. Just like everything about some of the high-end specialty offerings isn't entirely all right either.
Totally agree. We've had that for sure. I mean, and that's what we're talking about, right? So we're talking about the spectrum of care and standard of care, and what do those things
Right.
mean, and what do they mean to us as veterinarians, and what do they mean to our clients?
Well, and so to start with spectrum of care and what that really is, which is the topic of this, I'm going to start with a question. I'm curious to know what you think. Would you agree, maybe strongly disagree? Would you disagree with this statement? All pets deserve some level of veterinary care.
I strongly agree.
I strongly agree as well. And a majority of veterinarians strongly agreed with that statement.
I'd be surprised if that wasn't the case.
The reality is 28%, so over 1 in 4 clients or within the past 2 years have experienced some barrier to veterinary care. And that was a survey across all demographics. So one
Yeah.
in four, and by and large, that barrier is almost exclusively financial. Does
Yeah.
that sound reasonable to what you see in practice?
Yeah. And I live in a place where, you can't swing a cat without hitting a specialist, number one. And
Mm-hmm.
number two, on one side of my practice is the A-list of Hollywood rich people, up on the hills. And then down on the other side is all the people that, we take care of their cars and their animals and all of that other stuff, right? So I do see a
Right.
large spectrum of what people can afford. And I never assume what somebody can afford or wants to afford. And probably more importantly,
Or
I
is
try not to
willing to
judge.
afford.
Yeah. And I
Yeah.
try very hard not to judge
Yeah.
the people either way.
And we've had those conversations where sometimes it's equally as hard not to judge people who have resources and aren't willing to spend it on their pets as it is to people that maybe don't have the resources. So,
For sure. For sure.
and yet you look at some of the underserved communities and the incidence of having unspayed or castrated pets can be as high as 88% in veterinary deserts, which is,
Yeah.
again, not an acceptable if you're talking standard of care, which is the minimal basic level of care that we're providing to these animals in a community. I would say that doesn't reach the current standard of care across the US for what we offer in terms of
Yeah.
preventing unnecessary births.
Yeah. And I think that's important to look at too. I was just talking today with one of my colleagues about what is standard of care for where we are. And is it the same? I mean, you and I both live in California. Number one, is it the same in
Mhm.
California as it is in rural Minnesota? And number two, is it the same in all parts of California? Um, you would think that if we're talking about a legal definition of some kind or something where it might come to you didn't provide my animal care and I'm going to sue you for that,
Right.
yeah, they'd have to have the same definition no matter where it is. But I don't know that that's easy to do.
It does vary. It's so standard of care is is a legal term, right? So I wrote down how it was defined, which is the care required of and practiced by the average, reasonably prudent, competent veterinarian within your community. So there's enough, standard of care is very different than
Yeah.
spectrum of care and what we're talking about today. Standard of care
Right.
really only applies if you don't meet it. For that's when we would consider it a malpractice situation. And in
Right.
veterinary medicine, especially talking about spectrum of care and offering, sort of evidence-based treatment options
Hmm.
across predominantly you're looking at from less invasive and less expensive, but in some
Sure.
cases potentially less, less
Likely to work.
validated outcomes
Yeah.
or
Yeah.
less success, right? All the way up to, and sometimes we know that's not always the best either. Maybe that for a lot of conditions, just because we can do something doesn't mean we necessarily should. When you look at the evidence, is the increase in being more invasive, in stressing out
Right.
those animals, is that
Right.
worth the, 5% or 7% increase in survivability if the
Right.
quality of life is poor? I think for a lot of folks,
Yeah.
it might not be.
Yeah, and that's a reasonable question to ask. You know what the best part is that you said it's the average of what's practiced in your area. And the good news is that all
Right.
the vets in my area are above average.
Yes. Well, that's not good news for you. That's
No,
a
it's
high
not.
standard to meet every day,
It
but you're
is.
enough.
I I thank you.
And I just have to
Uh,
say, by the way, Dr. Mike worked all day today, and we are fitting in this episode at the end of a very long shift. And I can
right.
I can feel your energy drain. I know you just want to have
I'm
that the
I'm
gold standard, which is some
our drink.
curacao, some marshmallow flavored liqueur, orange juice. It's sweet, but it's
It,
good. So cheers
mm,
to you for still
cheers.
pounding out a
Oh,
podcast
thank
after a
you.
long day.
Cheers. Mm. I already took a drink. I'm going to lie. It's very sweet. And
Yeah.
I feel it like, after a long day, of actually dealing with the problems that we've been talking about today of like,
Yeah.
how much does blood work cost? And I cannot tell you the number of times I wrote down today, like, if financially feasible, consider this, course of action. If it's not, let's do this. And if it's, you know what I mean? That's all day, every day.
And to your point, one of the things the AVMA shared when they proposed this idea of training on a spectrum of care is that they looked at the statistics, and nearly every veterinarian in private practice that took their survey reported that they were trying to implement at least one strategy to mitigate some of the financial barriers to veterinary care.
Hmm.
So I was curious to know, first off, is your clinic doing that? Do you see enough folks, like with the writers' strike that happened in LA? Do you see enough folks where you actually, did some things or had payment plans or whatever that might be?
Yeah. As far as where we are, mostly it's just working with people as far as, putting things off, perhaps. Like maybe they'll put the dental off for 3 months when production starts up again. And we're in a place that there's definitely an ebb and flow of when people are working and how much money they have. And you can kind of feel it in
Right.
the community. It might have been the same when we were growing up and I just didn't notice it during, farming the different seasons.
Hmm.
I don't know.
Yeah,
There was probably a big ebb and flow of when they had money and when there was less money.
absolutely. I mean, as a farm kid growing
Yeah,
up and waiting for the crops to be harvested,
yeah,
and then we would always sell some in the fall to get kind of a wad of cash to live
yeah,
on through the winter. That definitely was the case, I'd say. And then some of the grain that we kept on the farm, we would sell again in the spring. So
right,
we'd get little like big fluctuations of our income in
yeah,
larger swaths. So yeah, absolutely.
yeah. And I think
Um,
our
I
biggest thing
can
that
see
we
that.
do is we're a one. I'm owned. Our practice is owned by just a guy who's had it for 50 years, and he gives us a lot of leeway in being able to decrease prices or give away a little bit of pain medicine. Um, it's basically a sort of a slush fund that doesn't actually have a fund, but if we know an animal's in
Hmm.
pain, absolutely give it the pain medicine. Don't worry about it. We will never get in trouble for that. He will never get mad at us for taking one extra x-ray just because we felt weird about something on it, just to make ourselves feel better. And so one of the reasons I like working where I do is that I have that freedom to do that. Other
Hmm.
places I know people work, they do have specific funds set up, and that happens every once in a while. Somebody gives some money, and we put a little fund and go like, oh, we can now help that kid who came in and has got his first job and is living paycheck to paycheck, and now his kitten is sick.
And I think most veterinarians like pain medication, things like that.
Mhm.
definitely we're going to be reaching for those right away to get those animals comfortable so that we can have a spectrum of care conversation with the owners,
Right.
talk about the options and know that they're comfortable. I mean, I think ethically that's the right thing to do, and I'm not sure if that's, I mean, obviously it's in our oath, and I
Yeah.
think in some states it is required, like that basic level. But I also know, depending on your state, sometimes if you start a level of care and then sort of drop back, that is not allowed. So at least in Washington
Interesting.
state, when I was there, we were already always told you
Huh.
could give pain medications, you could stabilize, but not start an IV, because if you discontinue that IV, then you were discontinuing the standard of care that you had started, and that would be considered malpractice.
Wow.
So we were very careful to talk to people up front, get the animal,
Yeah.
stabilized as best we could,
Right.
and talk to them right away.
Yeah. And I think the other thing to think about is I can remember, I have vivid memories of being in vet school and talking about the gold standard, you know? Like
Mm-hmm.
this is what you should offer, the gold standard. This is what and like there is some defining standard that always stays the same. And after being in practice for a while, I'm going to tell you that standard is not there. And if you ask 5 different specialists what that standard is, you're going to get 7 different answers.
Of course.
You know what I mean?
Right. And that comes, yeah, that comes down to, we really talked about this being two conversations, because protocols and standards of care, um,
Hmm.
is a very different conversation than offering a spectrum of options for treatment.
For sure. For sure. All right. Actually, should we take a little break here? Do you hear my cat?
I don't, but it looks like you
So,
need one. I
uh,
feel like I'm
hold.
over talking to just help you out here, because you are looking tired
I
today,
appreciate.
Mike. Is that, you
Thank,
should never
oh,
say that to
thanks.
people.
No, this is all right. Real quick. This is Olive, who is usually just a couch potato, and Lisa calls her our accent pillow
Oh.
because she just sits in one place. So I have all the animals out of the room, and this one is going crazy, jumping on my lap and distracting me. So let's take a quick break so I can take care of her, and then we'll be right back. I mean, put her
All
out
right.
of the room, not take. Okay, be right back.
Not take her out.
Yeah. Hi, this is Dr. Mike, the Bowtie Vet Guy. Thanks for tuning in to The Vets Unleashed. If you want to find out more about us or our guests, or to leave an amazing review, head on over to thevetsunleashed.com or find us on Instagram or Facebook at The Vets Unleashed. There you'll find information on the podcast, how to be a guest, and our lecture series and speaking availability. Now let's get back to the show. And we're back. We are talking with each other and having a nice
We are
cocktail after
talking and
my long
drinking.
day. We're talking and drinking after a long day of work. Well, we're talking about spectrum of care, um, and it's something that comes up every day, and um, what it means to have many different options, and what does it actually look like? What does offering spectrum of care look like? And so to me, I mean, I think the biggest thing is that you're giving options. And I mentioned a little bit earlier that it was things like when we were in school and they said, just offer them the gold standard and let them decide, right? And they'll tell you if they can't do it. They'll tell you if they don't have enough money to do the gold standard of something. And that never sat right with me.
Well, and to your point, what is the gold standard?
For sure. Like
Yeah.
there's going to be a lot of differences of opinion on what that means. And I don't know, I guess I think the gold standard would be the thing that makes the animal better that the person can afford. I don't know, maybe we're redefining the gold
I
standard
like
right
that.
here.
Well, and I think one thing to consider as we talk about providing multiple options, treatment options, we're talking mostly, or sometimes diagnostic options, but multiple, options at the veterinary clinic that probably are, most likely, because the barrier typically is financial. Most likely these are going to be things that are, from less expensive, probably less invasive, less technology, all the way up to most invasive, probably most expensive, most
Yeah.
technology, right? And presenting this
Right.
range. And I think the first thing we need to consider is that people always want to be offered the best, even if it's not the best for their animal, even if it's not something they can afford. They want to know what exists and they want to talk through the options with their veterinarian.
Right. And when you're talking through those options, it's like super important to talk about what the possible outcomes might be, right? So one of a good example might be an animal that's vomiting, a dog is vomiting, and does it have a foreign body or not? And if the people have money to do X-rays to even
Mm-hmm.
like to look for something. Well, if we don't do the X-rays, what are the possible outcomes? What is likely to happen? Um, if it's a dog
If it
that
is a
that
foreign body and if it's not.
and if it isn't, exactly. And so that they can make an
Right.
educated decision on what's actually the likelihood rather than saying if we don't take this x-ray they could die. That's uh they could
Right.
maybe, but we could also find a middle ground there of something like, okay, well, we can try to treat them symptomatically, but boy, if they continue to vomit or if they go downhill, you got to get them back here right away.
Right. So talking about outcomes, also talking about the advantages and disadvantages of each option,
Mhm.
which may extend beyond outcomes. The
Right.
cost would be an advantage or disadvantage. Sometimes the need for sedation or anesthesia.
Right.
Sometimes we start down that process like I think about Cushingoid animals, right? How
Right.
frustrating are they sometimes to diagnose? So
Oh,
maybe if you present it as, let's just do a low dose dexamethasone suppression test as a screen, relatively inexpensive, but how many times do those come back as suspicious of Cushing's disease? We need to do hundreds of dollars more testing, so I think a lot of it is talking about what might happen, right? Like we can do this test. And if it's negative, we probably will put Cushing's disease aside. But hey, one of the disadvantages of not doing all the tests up front is we may end up in a situation where now I suspect it more, but it's still not a diagnosis. And if you're not going to have that money, what do we do there?
yeah. I mean, I had one today that was a cat with a high ionized calcium. Right at end of the day, just talking about that. And it was because the calcium was high. And then they wondered, what's the next test? Well, let's do an ionized calcium to see if it's really high. Well, it's high, but
Yeah.
just a little bit. You know what I mean? Like one of these, like, can it just either be high or low, please? Like, can you just give me an answer? And it wouldn't, of course. And so, the
Yeah.
owners don't have tons of money. And so I'm racked with guilt thinking about like, what is the best way to spend their money? What recommendations should I make that I don't want them to run out of money before we get an answer?
Well, and sometimes
So,
that may be clinically irrelevant. I'm guessing you probably did a
uh-huh.
rectal exam.
Mm-hmm.
Uh-huh.
Mm-hmm.
And a
Yep.
full, and a very thorough
Yeah.
physical exam. So,
Yep.
I think sometimes we beat ourselves up, but, the reality
Yeah.
is,
Mm-hmm.
if it's a bad cause, if it's a cancer, if it's something like
Mm-hmm.
that, it's not going to get better. And we
Right.
may have our answer on the next exam. Yeah.
Yeah. Yeah. Yeah.
Hmm.
So in some cases, it's okay to wait a little bit and recheck something.
Right. Well, and I think it's fair in those situations to tell them right now I'm not that concerned. This is a small elevation, but the fact that
Yep.
the ionized was
It,
elevated as well makes me a little more concerned. I don't think we should forget about it, but I'm not going to lose sleep tonight, you know?
yeah. Yeah.
I mean,
Yes.
they want to know, like you can ask how worried they are and they might think I'm terrified because, you know, of a previous situation. My dog was hypercalcemic and did have a tumor and, you know, all these things. And so that's the conversations to have, right? Where you're asking questions and you're listening. Um, and also tempering that with your experience. I mean, have you ever seen a slightly elevated ionized calcium level presenting on emergency,
No,
and that's all you found? And you're like, yeah,
I have not.
um,
Yeah.
right. And if it continues to go up for whatever reason, you would start to see clinical signs associated with hypercalcemia.
Sure.
Correct?
Exactly. Right, exactly.
So
And those
maybe
are
just
all
telling
the,
them,
yeah, here's what to look for. Exactly.
so we've been talking about offering a spectrum of care to our clients. And specifically, now that we understand the concept and what it is that we're offering, a range of treatment or diagnostic options, what does good look like? So we just mentioned sort of active listening, honest conversations you mentioned that you have.
Mm.
A couple other things the AVMA says can be helpful that I really like the idea was another was reflective listening, where we actually hear what we say and we reflect back what they're saying, paraphrase it. So it sounds like you're more concerned, um, about this slightly elevated calcium level um,
Yeah,
than I am, right?
it
Or
sounds, Scott, like you're saying we should listen to what they're saying and then say it back to them, kind of just it, but in my own words.
no, that's not what I'm actually. Yes, it is. Good job. I did not see that coming. Wow, you just blindsided me with your brilliance there.
With that joke that
Communication
was,
guru that you
oh
are.
my gosh, coming right back at you from a
The
million miles away.
aristocrats. Oh, wait, that's a different joke. All right.
So
Yep. The other things they said is develop and deliver appropriate options that are evidence based. So, really, maybe even taking time. One of the nice things that you all have that I did not, well, I still had that luxury in small animal medicine, is we could leave the room for a minute. Let me go back and check on the lab results. Let me go look at those x rays, and then I'll put a plan together and talk to you. And how amazing is it when you're when you're not a single doctor to be able to go to your group of 6 doctors and say, all right, you know, I got this slightly elevated ionized calcium. What am I going to do here? Right. And
yeah,
hear everybody else's experience.
yeah, I think that's super important.
And last but not least is what it doesn't happen unless it's in the
Record.
yes, medical
Yeah,
record. So document
yeah.
accordingly. If you have a conversation about the adverse, the pros and cons of a specific option that they choose,
Hmm.
documenting that in your medical records and saying, had a conversation about outcomes. And although, you know, statistics don't directly apply to an individual patient, shared these data with them,
Yeah,
and they are aware of the pros and cons of this option.
yeah. Well, to like bring it back around to your veterinarian in Oregon, he's right.
Mm-hmm.
A very large percentage of cats, if you just lance the abscess, give them some antibiotics, and send them on their way, a very large percentage are going to be okay. Are going to, by
Just fine.
okay, I guess
Yep.
they're going to live through it,
Right. With
and that's
pain.
our with pain, but they will survive, and you will still have a cat. You know,
Yeah. And I
a
would
few months
argue
down the
some
road.
of that is probably below the minimum standard of care,
I would agree with that as well, but
which he's no longer practicing. So
so that's fine.
yeah.
It's okay. So he can be below the standard because he's not doing it.
Yeah. And we've talked about this. I still feel as though you get 100 general practice and ER veterinarians in the room. Every one of us is going to feel comfortable about presenting a spectrum of care. But who is teaching this concept to the next generation? Are students coming out of school understanding this is what they need to do and not judging? I don't think so. And I think that's primarily because, in my opinion, the specialists are as jaded to one side. They believe and they've been trained and they've been conditioned from their residencies and their specialty hospitals to believe that average clients, the norm is for people to really want the highest level of technology, the highest level of care at whatever expense that costs. And I think they've missed the boat on that specific training. They haven't been, a lot of them haven't been in the trenches. And I just really feel, and all my experiences recently with the teaching hospital near where I live, as well as a lot of the teaching hospitals. I don't think the specialists necessarily are the right people to teach this. I think it's the community practice folks, maybe the ER specialists, but probably not. I think it's those of us who have practiced with the general public or practiced in underserved communities.
I would agree with that. I think that the new graduates that I've worked with recently have all been very good, first of all, at what they do, but it's been very difficult
Sure.
for them. They really have a hard time presenting a spectrum of care because they feel like they're doing the wrong thing if they don't do exactly as they were taught in school. And that is a very hard thing to internalize for them. And I feel bad for them. I feel like I really want to help them learn that there is more than one way to do something.
And not every option is the right option for every single patient with the same exact condition.
Yep.
And that extends far beyond just financial barriers.
Yeah.
I just think the people to teach that we don't have in veterinary medicine a specialty of general practice or family medicine. I really think we should. I think that's where so much of this wisdom and this knowledge comes from. I don't think many schools are having these discussions.
We are.
Yes. Even if they have the discussion, I think a lot of the grads are coming out with this idea that the highest and most technologically advanced level of care is the best care. And I think those conversations need to be had in veterinary schools. Okay, we've got someone who's very motivated and we're going to use our cyber knife and do chemotherapy. And, it's going to be $85,000 for this animal's brain tumor and they're going to die from it. But, is that right for this animal and this family? And what about in general practice? What are you going to encounter?
And more to your point, if they don't do that and they walk out with nothing, have we done them a disservice?
Because they only thought there was one option and they couldn't afford it or were unwilling to do it.
I think that encapsulated it very well, Scott. And if you're a veterinarian out there that's just starting out or a vet student, start to think about this and think about what that looks like and what does it look like to offer enough for your patients that you can actually help them. Let's toast to giving people options.
To options. Cheers.
Cheers. Thanks for joining us for drinks and a conversation about veterinary medicine and our beloved animals. The Vets Unleashed podcast is wholly owned by the Vets Unleashed LLC with excellent production by Earweevil Audio. For more information about us, head over to thevetsunleashed.com. And as always, don't take advice from people who've been drinking.